So, hello everyone. A very good evening and a warm welcome to our homeopathy musings. I, Dr. Mansi Popat, I welcome you all to our platform where we muse homeopathy together. Today we have Dr. Ranjan Bilsare, sir, for the very first time. And I welcome you, sir. Thank you so much for joining homeopathy musings and uh, giving us this opportunity to learn from you. Today, sir, will take a session on mastering keynotes for successful clinical practice. I just wanted to give a little bit introduction about this, sir. Sir is a classical homeopath practicing since 10 years in Nagpur. He has graduated from Amravati with the flying colors. He was a gold medalist in 19 summer school of post graduation from National Academy of Homeopathy, Nagpur. He has completed his MD from prestigious National Institute of Homeopathy, Kolkata. And sir has learned from masters like Dr. Datta sir, Dr. Sarkar sir, and Dr. L.M. Khan sir, and Dr. Adhikari sir. He is also trained under international homeopath like Dr. Farooq Master sir. And he was presented with multiple awards like Young Achiever Award. Then he has taken multiple webinars on the rare remedies for Singapore Homeopathic Association, seminar on pediatric case solving and difficulties, and multiple various others. I welcome you, sir, on this platform on the behalf of Homeopathy Musings team.
Thank you so much for the kind invitation. First of all, I am audible?
Yes. So before going forward and before starting our today's session, I just wanted to brief about our upcoming courses on homeopathy musings. Just a minute. So hello everyone. We have this website called healingharmony.in, and from that you can go on the homeopathy musings and you can go for the upcoming online courses. We have today we have the sir's lecture free, as like today we have every month on the first Saturday or second Saturday we have this Saturday free live webinar session where we invite multiple homeopaths around the globe for sharing their knowledge and experience in homeopathy. Then we have multiple free sessions. We have this News with Masters series. Then we have this ABC of remedies where we learn, it's a monthly series, and where we learn one remedy in depth from the contemporary, integrating classical and contemporary methods of homeopathy. I just wanted to brief about the online courses which are upcoming. So we do have this Lanthanides coming in July 31st by Dr. Jonathan Hardy, sir. And it will be a 4 sessions, total 8-hour session. Then we have this basic course, Basics of Contemporary Homeopathy version 4 by multiple doctors, Dr. Preeti Shah, Dr. Prajakta ma'am, Dr. Raini sir, ma'am, Dr. Joy ma'am. Is starting from October 2025. Then we have in very upcoming in July, 4th of July, it's starting with homeopathy for anxiety and panic, a 360-degree approach, case-based learning by Dr. Aradhna Chitra ma'am. Then we have Centennials coming in soon by Dr. Dinesh Chauhan sir. Then we have psychotic disorders by Dr. Preeti ma'am and Dr. Prajakta ma'am on the 1st and 15th of September. It will be a 2 sessions, 4-hour sessions, and it will be a case-based practical explication of homeopathy and contemporary concepts of homeopathy in psychotic disorders. Then in July, 9th of July, we have treating pathological cases with homeopathy using HHF mind method by Dr. Mayuresh Mahajan. So it will be a clinical session and I would really recommend to join. Then from a well-known ma'am, who don't need introduction, Dr. Nandita Shah. She will be taking a course on nutrition in homeopathy, enhancing your practice, reverse chronic disease with effective nutritional guidance. It will be a 4-session, total 8 hours in the month of August. Then we have a very clinical webinar, 1-day session by Dr. Ashok Borkar sir, managing pathological advanced cases with homeopathy. So likewise, we have taken multiple 1-year courses on mollusk, on animal remedy, animals, in-depth plant module, in-depth animal module, and so on. Without taking further time, I'll just stop the sharing and I'll hand over to the sir. Before starting our session, I just wanted to give a brief guidelines about the webinar. Please mute your lines altogether when the speaker is speaking so that it doesn't disturb sir. And also we will have any, if the comments or questions, you can just put it on the chat box and we can address it later at the end of the seminar. Thank you, sir.
Thank you. Thank you so much. So thank you so much for Homeopathy Music for inviting me and giving this opportunity. Basically, keynotes are the method which I follow in my clinical practice since 10 years. I am a converted homeopath. I was not intended to do homeopathy, and basically a turnaround happened in life, and I joined homeopathy. After that, it is very difficult to a person who is not from the background, who came to homeopathy and to learn the basics of homeopathy in this latest in the last stages of the degree courses. So it is very difficult to practice how to practice homeopathy, what are the symptoms to prescribe upon, and that's how my journey started. Then fortunately, I landed into National Institute of Homeopathy, Kolkata. There I saw uh, a very different approach from what can I say from the other contemporary approach, and that was the keynote approach, which we are going to talk about. So why keynote approach? Okay, so since the beginning of homeopathy, the biggest disadvantage the converted homeopaths or the new homeopaths who were joining the homeopathy was to understand and to grasp the mathematics. Many of great minds left homeopathy because they couldn't assimilate, they could not accumulate, and they could not adapt to the vastness of the mathematica. Because mostly and solely at that time, the mathematica was only from the proven sources. Then came Dr. Herring, who had added more and more symptoms from the traditional sources, from the provings, from the toxicological points, and from his clinical verifications. Then the mathematica becomes so vast, it was very, very hard to assimilate and to remember all these symptoms. Then came the repertory part came very later after the Kenshin era started. So before that, there was only and only Puritan mathematicas, and the mathematica was collected from the various sources by Dr. Herring. After that, there was a need that how, if you want to practice very correctly, or if you want to practice in a efficient and in a less time, there was increasing demand of condensed literature or the condensed uh, symptoms which can be verified, which can be useful in the practice. So then Dr. Lippe came forward. He gave the red line symptoms. Then Dr. Allen came and he gave the famous Allen keynotes. So keynotes are very much important if you want to practice in a very precise way and in a very short period of time. In our clinic where I practice in a very rural area where I have to see number of patients in very short period of time. So there and there clinical, if you have keynotes in your backhand, it is very handy and it is very accurate to prescribe in very short period of time. Okay, so the journey of keynote is always fascinating. because many of practitioner at that time was was converted, and they were not very good in application of materia medica. So many of them are doing polypharmacy, 2 or 3 or 4 drugs in at a time, and which was condemned by Dr. Hahnemann when he was moved into the Paris, and he was very much saddened how the France homeopathic physician was practicing at that time. And after that, the time goes, the demand of the condensed literature was becoming more and more. Okay, so that's how the keynotes were started in using. Then Dr. Boger has also given a condensed synoptic key, so that s- the the practicing physician or the student can at least know what are the basic important points of the drug, so that you can prescribe upon that. When when the indications are clear, the case is clear, you can prescribe on these few indications and you can rely on that, and the results are inevitable, which I also follow till date in my practice. Okay, so how to read keynotes and how to uh, understand it. I have a separate lecture which is available on YouTube, so you can go there. In today's lecture, I am going to share you my personal experience how to apply it in very efficient way. After you read, after you know how to read the keynotes, the next and the most difficult part came is the application of the keynotes. How we application of the keynotes? It is a simple formula. If I want to say, that's how I saw perceiving and applicating in many cases from my master. This is the basic way of application of keynotes. You can apply it in very efficient way. First and foremost point is observation. If you observe the patient thoroughly, you can start your differential diagnosis of the remedies from the start of the as soon as the patient enters into your clinic. Okay. If you go in the introduction of uh, Alan Keynotes, there Dr. Alan writes that the sole work of or the sole duty of the student of mathematics is to differentiate uh, uh, into the remedies. That you have to differentiate every time. You have to differentiate to the remedies to uh, to reach into that the correct or the simillimum remedy. Simillimum word came later after Dr. Kent started lecturing on mathematics. Before that, it is the correct remedy or the similar remedy, which we can say. So the first and foremost is observation. When the patient came, okay, you can start collecting keynotes from there and there. Many of us think that we read Allen keynotes and the patient will tell us the keynote and we will prescribe on them. No, sometimes you have to observe the keynotes, and that will happen as soon as the patient will enter. Okay, so when the patient enters, what we can see is it OPs, just like in antim-crude, just like in calcarea carb, just like in calibro, just like in uh, 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 lycopodium, or it is scrawny, or it is thin, like in sickle core. How the patient looks? Is it blonde, light hair, like bromium, or it has a dark hair, dark complexion, like muriatic acid? How he sits? He sits in a falling manner, like in sternum mat, or it sits in a very relaxing or comfortable way, or it sits like a stooping way. The keynotes have all these symptoms, but we ignore the first part and we move on to the only and only the parts which was and we expect that the patient will tell us the symptoms and we will prescribe on it. No, the keynotes contain from top to bottom of your case taking. When the patient enters, you can prescribe on only on entering or how he is entering. Is he entering very nervously. So nervous temperament drugs, or the patient looks very frightened, melancholic, in the melancholic way. How the patients talk to you? Is he yielding? Is he very rigid? So US case taking starts from this only. Okay. So one day when I was in OPD, my one of my teacher was seeing patients, and a guy came very hurriedly and sat down on the chair. Sir, please see me. Plus, sir, please see me. Sir, please see me. Sir, please see me. So what happened? What happened? What happened? And he told 2 to 3 symptoms, and uh, my senior prescribed argentum natricum. I say, why, sir? Why argentum natricum? The impatient behavior. The impatient behavior cannot wait. Just please see me. Hurriedness. This is how we can we can come to the remedy. And of course, there was other symptoms also, but that was the point of differentiation. One patient came and said, oh, sir, please save me, sir. Sir, please. I don't want to have, I can't eat, I can't eat. Merckson, fast speech with aptheid. So that's how, this is all in our literature. This is all in our keynotes. So the first is observation. We have to make strong observations, how to perceive the patients. If you go through the, then if we can do constitution, constipation, we have many remedies. Naksumika. How the Naksumika patient will look? Rigid, ardent. What if you have to prescribe plumbum for constipation? Just check the abdomen of the patient. Is it retracted abdomen? If the abdomen is retracted, plumbum is the remedy. If the if the abdomen is saucer shapes, we can give calcareophos, we can give silica. Just touching the palms, seeing the palms of silica, moist palms. One day a patient came to our OPD, and he was having his socks. As soon as he entered, whole room was so smelly that no one can stand there. And I just asked her, are you chilly? Yes. What are your complaints? Sir, I have this allergic rhinitis. Whenever I go into the cold or the dust, I catch this cold and I start sneezing. Just show me your hands. Hands were very cold and perspiring. Silica was the remedy. So as soon as you enter, as soon as the patient enters, then and there you can find the correct remedy of the patient. And it is all in our keynotes. When you go through keynotes in silica, you see offensive perspiration of foot, offensive perspiration of the body, and the patient is very timid, if you can say. So the observation part is very important. If you go through fluoric acid, we have this foggy glabella. The glabella part is swollen. The sunken eyes of China patients can also tell you many things. A patient who is suffering from continuous fever and who's having gas trouble, and these eyes were sunken, patient was very thin, and Dr. Alam Khan, I was learning under Dr. Alam Khan, sir, and he just asked one thing: if you have any history of blood loss, if you have any history of profuse leukorrhea, if you have any history of long lactation, the female said, yes, sir, I had history of long menses due to my fibroid, like that. And after that, all these complaints started. And China was prescribed to lady that healed her completely, and he gained weight, and all her constitutional defects are also covered. So as soon as we see the glassy eyes, the sunken eyes, or the what we can say, the eyes of belladonna. One day a patient of ADHD came to my clinic, and he was doing these things. and he was uh, going there, here and there, here and there. If you go through belladonna, there is only one line: quick actions and motions in italic. Eyeball move frequently. His eyes were, he has having this nystagmus. So combining these two, and I just asked only one question to the lady, to his mother, that is he fear of dark? Well, yes, sir. He he had no fear at all except dark. He cannot go into the dark. We had to put a light bulb or a small light like a night lamp in our room. If the room is totally dark, he cannot sleep. He will cling, he will cry. And belladonna was prescribed to this ADHD patient, and now he's improving very, very, very rapidly and very, very good. One day, a patient of again a patient of ADHD came who was very all the milestone was very delayed. He was mostly autistic, and he uh, was sitting with his mother, and he told her mother, please mom, give me some water. And in one go he had finished whole bottle. And I asked just one question: how he sleeps? He, the mother told, he sleeps on abdomen. What happened in your pregnancy? I have to take so much uh, uh, medicine for him. I was going through infertility, and after, and then the child was born. So the history of psychosis, great thirst, and the metronome was prescribed. So not only the constitution, not only the physical symptoms, we have to careful, we have to be more observant with the uh, actions also. And this will give you free hand in prescribing and very ease and a perfect clue for the prescription. And that's how the clinical verified keynotes help us. Large quantity of water, drinks large quantity of water, even the dreams of drinking, like in iodine or in medorrhinum. So that's how should be our approach. We have to study keynotes not only by line, but this way also, by imaginative also. That if the patient come, how he is looking. Obesity in later part of the life. पहले तो सर मैं ऐसा था. I was thin. Then gradually, my weight was increasing, and now it is not going. It is not coming down. I am suffering from acidity. I am suffering from urticaria. And Team Crude is the remedy. Many times, only seeing the patient, we can tell. In our materia medica, I say our materia medica is a woman dominant materia medica. It is very feminist, we can say. Many remedies are for the females, very few are for the males. And one of them is Mercor. If you go to the first line of Mercor, there only it is written diseases of men. Otherwise, if you go through any remedy, most of the remedies, diseases of women. Diseases of nervous, hysterical woman like ignitia. Diseases of mild, gentle woman, timid woman, like this. So, if a patient of IBS came, if the patient of antral gastritis came, if the patient of Bright disease came, we can, if the patient is male, we can think of Mercor. Then you ask the other question. Totality is always important in this aspect. So what we can do is try to learn the keynotes in this way, in this beautiful way, or by observing the patient. How is the character of eczema? Is it weeping, like Dalkamara? Is it dry, bleeding, like graphitis and like graphitis, soranum, and petroleum? So that's how we have to go through our keynotes. And if you want to master keynote, we have to apply in it like in that way. Keynote is all not always for mugging. If you mug it, you will forget it. If you want to learn keynote, just learn in this way. Okay. So this O is for observation. Then we move on to subjective symptoms. The subjective symptom should be along taken with the objective symptoms. The subjective symptoms, which are came in the latter part of after 4 or 5 lines from the keynote, in every remedy. Uh, First few lines are mostly on constitution, then generals, then simply the subjective symptoms schemes. So on in these subjective symptoms, we have to ask patient, we have to differentiate patient, just like how it has happened, how it has, uh, how it aggravates. Patient said, "Sir, my cough is getting worse from lying on right side, anti-inflammatory. It is going on. I feel better on left side." Or the patient will say, "Whenever I feel, uh, uh, whenever I feel the pain, my I have this tendency of increased urination, thuja." So with this subjective symptoms, we have to study what is with the subjective symptom. The tenesmus armored by after stool, naxomica. Tenesmus not better by stool, Merck's. So whenever we have these subjective symptoms, we have to differentiate it with the modalities. And that's how we can prescribe on any disease. Not just Naxumica for constipation, for podophyllum for diarrhea. No. If you see in podophyllum, it came very close to lycopodium. It is very right-sided. It has all right-sided affection. It is a bilious constitution. But only difference is the podophyllum patient is better by, it is thirsty and it wants cold water. Rather, the lycopodium wants hot water. We have to go in depth with the modalities also. Many times we stuck in the generals. If you see lycopodium patient, desire for warm, desire for warm, desire for warm, better by warm. But the lycopodium patient's urticaria is always worse by warm. The lycopodium patient's skin symptoms are always worse by warm. Antincrude is a hot patient, cannot tolerate sunlight, but its symptoms are better by warm. Its skin symptoms are always better by warm. So we have to always have to differentiate in between the subjective symptoms. Subjective symptoms sometimes taken as plain without the without its specifications are not used, and they are going to be complete failure if you prescribe on that. I have this abdominal pain, I have this diarrhea, I have ate so many that things last night, and since I am having this complaint, and we simply prescribe Naxumica, patient not get better. No. What type of food we have ate? If it is a fat food, go for pulsatilla. Did you have overeating? Did you eat more than your normal capacity and you have constipation? You get constipated and now you have diarrhea. The tongue is coated. Anti-include is the remedy. If you have the symptoms that there are only eructations are coming, bitter eructations, carbo-veg is the remedy. So we have to differentiate in between the lines. So the subjective symptoms should always be complete with the modalities or the concomitant or the associated any symptoms. Otherwise, the plain symptom is not going to work. What we do, we try to avoid all these symptoms, all these finer details, and we always focus on mentals. We always focus on some peculiar behavior or how the patient is presenting his symptoms like that. No, If you see, if you go through Tyler, Dr. Tyler said that if you want to have prescribed lachesis, sometimes the lachesis patient is also being reserved. But in our mind, we have this fixed image of lachesis that no, he is very loquacious, give him lachesis. No. So the every symptom, every subjective symptoms, if we have to take into the totality, should be completed with the modality, with the concomitant, with the sensation, peculiar sensation like that. Otherwise, taking the plain symptoms is not going to help you. And that is the beauty of keynote, because in keynotes, we have the general symptom associated with his concomitant or with any modality. Okay, so that is the beauty of Allen's keynote. Are you with me, everyone? Is it okay?
Yes, sir.
Yes.
Okay. So this is how we have to proceed in keynotes, not only by mugging. Patient will never tell you that that this is my keynote and just prescribe on that. Sometimes we have to see it. Sometimes we have to observe it. If you take uh, a patient, uh, I will give you some example from my clinic. A patient of came to the yes, yeah. Yesterday a patient came for his he came with his children. Okay, sir, please uh, give him some remedy. His teeth are becoming decayed. I said, just stop his candy. Stop giving him some sweets and other things. And he said, yes, sir. We have stopped all these things. Still, but the process is now, uh, but the process itself is not stopping. Just give any remedy for this only to stop his caries. I said, how he's very irritable. He's very uh, uh, restless. He cannot sit in one place. He has so much energy. We prescribe him coca. If you go in Allen Keynote's last line, coca, it's written, prevents caries of the teeth. And it is a mountainous remedy. What is in the our now we when we were children, we used to eat that sugar candies made up of sugar. Now they all have this 5-star Cadbury, which contains coca or cocoa powder, which gives you immense energy without eating anything. So most of the children which seems they are tubercular, maybe they are not tubercular type. This is the effects of these chocolates, the sugar rush, which it's termed as sugar rush. So if you have to antidote the effects and prevent the caries, coca is very beautiful remedy. And we mostly bypass to this remedy coca. We give Mercsol, we give creosote, we give some other remedy for keynote. We never think of coca. It is written in coca, prevents the caries of teeth. And now in our clinic, so many parents are coming for this complaint. Sir, please kuch kijiye, sir, iska daant dekh. See his teeth, sir. We have already done 2 sittings of RCT. Now we don't have to do more. Please do anything, something, sir. We never think of coca. So the tubercular child with this caries teeth, we can think of coca. So that's how all the things combined we can use beautifully, and we prescribe very correctly in this type of patients. This beauty only comes with the, if you know the proper indications of the remedy, which gives you the freedom to use the remedy in any case. And this is the beauty of Allen Keynotes. If you see many patients of autism and they came with or ADHD, or they have always this fidgetity of hands. They are doing like this, like this, like this, something, some moving there and there and there. And we never think of Calibrom, where it is written, the remedy is especially suited for children. The children who has having night terrors with the fidgetity of hands and the other melancholic symptoms. See any history of uh, any depression in the mother or like this. You can easily prescribe Calibrom, which gives you very good results. We always think of tuberculinum. We always think of tarantula. We always think of uh, this high stramonium. We never think of Calibrom in this autistic children who have this. This is the very common feature, and we've always missed it. It is written in Calibrom, fluidity of hands. In brackets, you have zincum. Patient came to your clinic and always tapping your legs, and you cannot concentrate. Patient is like this. Yes, sir, I have zincum matters. Then you go for the other symptoms. So the complete picture is always with the other symptom, but you have to approach the remedy, approach the uh, patient like this, and complete the symptom with the other subjective symptoms, and the subjective symptoms always be with some other concomitant or the modalities. That's how you can succeed in your practice. Then the next part comes in the practice is the prescription through anamnesis. What is anamnesis? Sometimes we go, we take a case and we didn't know what to prescribe upon, because uh, the patient shows that maybe the trace of 5 to 10 remedies, or sometimes the patient will have no characteristic or the special specular picture at all. At there, you have to go from the its origin sites. Remember, when you drop a stone in the still water, the waves go far ahead. But the point of contact is the main origin where you have started. So in homeopathy, after number 5 is the most important point in the whole history of quantity. We have to go in that. If you have this type of patients, you have to go in the backwards in the anamnesis, how it all started. For example, I had a case of urticaria, a woman who has having urticaria. She was suffering for 1 or 2 years. She had done all the allopathic treatment. She went to 1 or 2 homeopaths also. She went to London, and the history she has given was I went to London, I went to the garden, I went after that, after some time, the urticaria started. Many people were focused on this, and she had given epismale and like this and like this. I observed her eye. She was blind from one eye. And I asked her, ma'am, what had happened to your eye? Oh, doctor, I had contracted a very bad measles in my young age, in my childhood. And after that, now I had some or other issue in my life. And in that, due to that measles, I lost my one eye also. Okay. And then I only ask one symptom. Do you have some gastric trouble? Yes. I have this flatulence. And does it better by eructations? Yes. If the gas come out, I feel better. I only prescribe Carbovage 201 dose. Never well since the attacks of measles. And his whole urticaria was gone. Since 2 years, she was suffering with one dose, whole urticaria. This is how we can think of uh, our the keynotes are useful in the treatment of the patient. We have to go into the anamnesis of the patient, how it had all started. Sulfur, not better after any abortion. Sickle core, we know that this is the symptom, never well since abortion. In sulfur also we have never well since abortion. Many times we don't get symptoms like sickle core. Sometimes sulfur is the remedy. So in the depth we have to go. This is anamnesis. And after you have done all these things, choose a remedy, give it in a smallest dose. Then if you have then you have done the 50% of your work. Okay. So if you do these things, 50% of mastery is done in Allen keynotes or the keynotes, that you have also good observation power. You are taking subjective symptoms with them with the in completion with the rest of the time, rest of the information like history, like concomitant, like modalities, like sensation, like all that things. And then you have done anamnesis also, and you have prescribed a remedy. Then came the parts of analysis. How the patient is improving after your remedy. Is improving very good? Stop the medicine, give it him, put it him on PL. Or now the action of is ceased. Many times we see children's in our OPD, and this is my favorite example because many times we fail in this. That patient is having this cough. We give Drosera and Drosera, the patient is better. And the patient said, no, sir, he's better, but still he coughs even on and off, on and off, on and off. He's not 100% better. And we increase the potency, and the next time patient came with the aggravated response. That's why Dr. Hanneman said that Drosera should be given in one dose, and we have to wait. If you wait it very frequently, it will cause a severe aggravation because it is of tubercular origin. So what? If the patient is improved on Drosera, but not 100%, if you see last line of it is written that when the Drosera, with the Drosera, if the patient improves but not cured, give Sina. Sina. And that's how we see in many children that they require Sina. After that, the whole paroxysm of cough had stopped. Now there is now the weather is coming of cough and colds and coryza. Now we have to be embraced with all of this, all over armamentarium. This should be thought of. When you give Kali Carb and the patient is improving in lumbago and her hip pains are gone, but said, now doctor, we we have given so much medicine, now it is so much time, but I am better, but it is not completely gone. Maybe it is he needs fluoric acid. So many patients came to in our OPD. And after Kalika, we give a history of injury. Now we had avian. After this long course of steroid, we have to admit it during COVID. Now we suffer avian. We give you give Kalika, the patient is improving, but now the patient is not improving. It is standstill. Now you have to analyze. Then the next medicine should be acid fluor. So we have to analyze what comes next. What should the patient wants next? What should be our next remedy? What if they happen? And these all things are beautifully explained in the Allen keynotes. When you go through the Allen keynotes, you will see that many relationships will solve our 90% of our problems, 90% where our cases are being stuck. Mostly our cases are stuck are not due to medicine stopped working or we are not getting any other symptom because we do not know the proper relationship of the remedies. Many times student ask me that, sir, my patient is this much better and now he's not improving at all. I have tried everything. I just ask them, did you follow this? Did you have given this? No, sir. Just go through the relationship chapter. And you will see so many symptoms, so many medicines which will you never thought of that you have to be given along with the your indicated after your indicated medicines. And we are very fixed that only one drug should cure. If you the constitutional one drug will take care of everything. No, that's why the relation chapter is so much important. So that's how we have to do this all the uh, analysis. Then there comes the point of miasm, how the miasm should be treated. Soranum, if you go to not for anti-soric, but it is a very soric medicine. It is soric medicines. So when the your patient start improving, or when the patient says, "Sir, I have been to 10 homeopaths. Recently I had a case of very bad psoriasis. The patient was from my village. He came to meet me, and he was suffering from psoriasis since 20 years. Taken multiple treatments, multiple homeopaths. And he said, "Sir, please do something." And first time, definitely, I was very reluctant. Which sal, the patient is suffering from 20 years. You will not have any dare to take the patient. Maybe he will improve or not. Who knows? But he insisted and he came to me, and the patient said, "Sir, please either give me medicine or either give me poison. I'm fed up with this disease. I cannot tolerate this itching and cannot tolerate this whole suffering. Either finish me or please cure me." That was his words. And he was from my same village. The medicine I gave was Soranum. Despair after itching. If you see in Cantripity, it is also one remedy for 3 marks. Despair after itching. Many patients said of and after Soranum, he was very much better. So the anti-miasmatic should be thought of on the lines of symptomatology, on the symptoms, on the keynotes. We give anti-miasmatics haphazardly. Cancer ka, he had history of cancer, give cancer, carcinogen. He has history of tuberculosis, give tuberculin. He has history of this, give this. This is not the way of giving anti-miasmatic. Anti-miasmatic should be done with the help of symptoms. If you go through chronic disease, all the remedies in the chronic diseases are anti-miasmatic remedies. Any medicine can come before or after. But if you are seeing of the king remedies, these are different. Either start with that anti-miasmatic, or if you not have that indication of that remedy, other remedy comes, and the patients want that anti-miasmatic remedy, prescribe that remedy only on indication, only on the keynote, or only on the proper symptoms you get or the history you get. Otherwise, giving anti-miasmatic remedy haphazardly will not solve your case. It will only worsen the suffering of the patient, and it will more complicate the case. Okay. So that's how we have to use the keynotes in a very beautiful and artistic way, or a very, which can be in a systematic way, proper way. Otherwise, if you learn and if you read keynotes like other remedies, it will not going to help. And only focusing on the only one part of the patient will not also help. Constitutional. What is constitutional? Constitutional nothing, but the patient should be we have to match the patients on his physical level. We have to match the patient on mental level. We have to match the patient on the materia medica level. maybe on the the totality of repair totality. After that, if you give one that remedy will cure it. But before it, we have to do all this homework. And if you have many patients, it is not possible many times to go through all these details. And still you have to be very sharp, very accurate, and very justifiable in your practice. Keynotes are indispensable tool in your homeopathic practice. Okay. So I urge everyone to start uh, accumulating your this knowledge from keynotes. Also start to engulf or amalgamate your practice or your knowledge with these keynotes, so that the results of your cases will be much more uh, what's been predictable, that yes, the patient is going to cure 100%. And this is a very easy tool, and it's very easy to master if you try to learning in this way, which I told you. Then it is a piece of cake for everyone to practice homeopathy. So uh, thank you, thank you so much. uh, Anyone having any questions? Any questions regarding anything?
Sir, one Dr. Sandhya has asked,
Mhm.
uh, in skin inflammation, sulfur graphite works but not complete cure. Then how to tackle?
That's how what I said, that how patient is suffering, what the patient is giving you the symptoms like soranum or the other remedies. If you see, there's many times syphilis also came. When the sulfur indicated sulfur doesn't work, we have to do syphilinum. So that's how you have to see that what picture the patient is showing to you. Just giving graphitis for the cracks is not going to help you. Or maybe that time the sulfur is not needed. If you see, if you read Corallium rubrum, we have this plant, palmoplantar psoriasis patient, and if you see in the relationship, Corallium rubrum, the complement is sulfur. So many times, sulfur patients, palmoplantar psoriasis, desire for salt. We sometimes what we do, we bypass the most characteristic symptom because we see the general picture, the incorrect general picture. Okay. So patient needed Corallium rubrum first, then maybe sulfur.
Yeah.
But we put him on sulfur, the patient keep aggravating, or sometimes it happens that the case was going went to somewhere else. So we have to find correctly what is the symptom or what the patient wants after the one correct prescription had done. Okay, next.
Can I ask something?
Hmm.
Yes, doctor.
Yeah, Dr. Jyoti here. I just wanted to know that there are many these skin cases, where there is a weeping eczema or things happening, and they are better. Like you mentioned very nicely, that we give certain leading symptoms, giving us to a remedy. And then in between, yes, we understand we give sulfur or whatever the indicated medicine comes. For a while, they are fine. And when they come up again, they have other added symptoms also, added something different. If a female comes and then she has suddenly leukorrhea along with it, the discharge is set in, or there is some other thing which are added to it, and the initial complaint also has not been better. How do we look at this, sir? How do we look at this kind of a thing, and how do we use Allen's in this cases? What should be the approach in such type of case?
This should be then there will be the amalgamation of symptoms. Maybe your
Hmm.
medicine is not proper, we have given the patient the wrong medicine, and the patient should be antidoted with the another remedy. So we have to be
Okay.
very proper in our next selection, that which covers
Hmm.
leukorrhea, the new symptom, which covers
Hmm.
our older skin symptoms,
Hmm.
match both the
Hmm.
symptoms, then prescribe on the symptoms. Sometimes there is a
Hmm. Hmm.
miasmatic elimination. We had said the discharges starts. Okay,
Hmm.
so there, if the thing is that, then you have to wait for some time. Uh, Keep looking how the thing changes. If doesn't, it getting worse, you have to antidote the remedy. We
Hmm.
take
Hmm. Hmm.
Sometimes
Hmm.
we take our remedies as granted, that nothing happens. Sometimes we don't give the similar remedy. The medicine had never worked.
Hmm. 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 Hmm.
In that dilemma sometimes, that we give
Sir, yes.
remedy, if it is not,
Hmm.
yes,
Hmm.
है
Hmm.
ना? We give that remedy
Doctor.
and nothing. Yes, that we move on to the
Hmm.
next remedy. That didn't also help. But every remedy is adding some or other of its layer on that patient. If you go the wrong remedy, if you want to see it, you have to just read uh, uh, the book by Dr. John Vithokas, Burn Seminars. It's a very small book. He had a case of pneumonia. He's treating the patient of pneumonia in that book, and the lady has given kali carb, and he has suddenly developed some next like this. He had developed some symptoms, and Dr. Buchalka said, this is due to the kali carb which I given previously. This is not the new symptoms. So if you, after giving the symptoms, any remedy which is not right, it will shake the vitality of the patient, and it will have bring some more symptoms. So you have to be very specific that how your medicine has acted. If it has acting this way, you have to antidote it most of the time. So take the new symptoms plus old symptom, combine them and give the proper antidote. Or sometimes mostly the antidotes are mentioned in the relationship part, that if it is happened, if you give so too much mercury, antidote with heparin sulf. That's why it is written there, because the mostly the patient will present with that symptom. That's why Alan Keynotes help in this also. Are you are you is it okay?
Yes, 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 sir. Because I realized that the second prescription becomes very important. First
Very
comes out
important.
to be, oh yeah,
Yeah,
this
and
is
those,
where the thing is.
yeah,
Hmm,
those who
hmm,
are
hmm.
very analytical, and they will know that this is not the new symptom. This is the symptom blender made by me. That I have given.
Absolutely, yes.
This is
We
given
gave
by me.
something which is,
Yeah.
and maybe in long run, that is where most of the time what I have noticed is in all years of practices, many a time that the first remedy comes out because we
Yeah.
understand totality, everything comes. But when it goes to the second and the third one, that is where the everything begins
Yes.
after giving the first one. So
Yes.
that becomes a big point to tackle.
That then you have messed up the totality of the patient and messed up the vitality of the patient. Now just go for the antidote. Wait for some time the patient the symptoms to get settled, and then prescribe on the remaining one. And if the I can tell you the another scenario, if the patient had better with the original complaint and new symptoms appear, wait for the few time. Don't change medicine accordingly.
Exactly. This
We
happens.
have
Yeah.
this tendency, now we have this tendency. Oh no, carbovate, Kali ka patient now he has some flatulence. Now give him carbovate. No, settle it. Please have it. If the patient, the symptom is persistent, constant, and have intensity, then prescribe on that. This also be written in keynotes. If the patient have this symptom, then only you have to give it. Otherwise, the patient is having gastric trouble, you are giving carbovate. Why? Is it bothering the patient? No. It may be due to some indisposition. Patient have been to the weddings in the, we have this whole wedding season in the summers. So he had to multiple weddings, and he's eating all the rubbish, and now he has come with a gastric symptom. Don't try to change the remedy if the patient's other symptoms are very better. It will also
Yes.
mess with
Lifestyle changes will take care.
yeah, this will
Lifestyle
also
changes will take care.
yeah,
Yeah. Yeah.
100%. Give some suggestion that do like this. In this you have to give some material doses. of any remedy, it will not disturb the patient's actual original remedy, and the patient's symptoms also go away. It is written in very good written in Farrington. If you want to read in lycopodium, Dr. Farrington reads when the patients have better is better on lycopodium, and when the his flatulence or the point of is suffering shifted from right side to left side, the gas is now on splenic flexure due to acidity or gases. We have stomach also there, na, in left side. He said, don't repeat lycopodium, don't give anything. If the patient has uh, this symptom very disturbing to him, give balsamum, Mamodia balsamum in material doses, so that it will not disturb the action of lycopodium. So see how keen those stalwarts was at that time also, that they do not want to disturb the action anyhow. So if you have this scenario also, we have to wait, watch, then decide.
Hello, sir.
Hello?
Sir, can I speak in Hindi?
Definitely, no problem.
सर आई हैव पेशेंट, जैसे मेरे पास पेशेंट है गैस्ट्रिक एसिडिटी, कार्बोवेस दिया मैंने, लेकिन उसको रिलीफ आ जाता है, लेकिन उसका ना बाकी सारे सिम्टम ठीक है, एनर्जी लेवल, भूख वगैरह सब कुछ ठीक है, लेकिन उसका जो जो एंटासिड वो मॉर्निंग में लेता है ना, वो नहीं छूट रहा। इवन मैंने काफी पेशेंट्स में, जैसे लेडीज हैं, पसेटला भी दिया, ऑल ओवर द सिम्टम इज बेटर, बट जो एंटासिड है वो काफी पेशेंट्स का नहीं छूटता। व्हाई सर?
Because they are very habituated with it. Sometimes the dependency does it, sometimes the psychology does it.
Yes, sir.
So you have to be very specific in your prescription. First, sometimes there are very good drug like Quashia.
Washia.
Quashia. Quashia. Boric. Quashia is a very good remedy. If the patient is on antacid and you have to taper it, and the patient needs something to neutralize this acidity, you have to give this remedy in between so that the patient get very better, and the slowly you can taper it afterwards.
सर एक जस्ट मेरे पास एक एक्सपीरियंस भी है, उसके बाद मेरा क्वेश्चन है कि आई हैव एक्सपीरियंस ऑफ हेलीबोरस केस। ही लेडी हैज अ माइग्रेन and some acidity problem something, and patient give me the modalities. I tap it on the repertory, and medicine is hellivorous, and I just read the medicine. Patient says कि मैं अपने बच्चों को कहती हूँ कि मेरे सर को दबाओ, यानी मारो, लेकिन इन द हाँ बाय हैंड, his hand lightly hand, but in the cases sorry, in the Allen keynote patient, the written is that he patient beat his head with palm. but in every other यानी ये सिनारियो जैसे मेरे को एक्सपीरियंस हुआ, तो अब मेरे को ये नॉलेज है कि मैं हेलिबोरस ऐसे प्रिस्क्राइब कर सकता हूँ, लेकिन बाकी अदर मेडिसिन में मेरे को वो एक्सपीरियंस नहीं है, जैसे कि वो क्या बोलेगा कि
that's I will tell you one quote of Dr. Fatak. If you read Fatak Materia Medica, na, there is written that you have to know your remedies like your friend.
Yes.
Like by his hair, by his sense of walking, by his if a breeze comes and you send that, "Arey, mere bhai ka perfume I like that," hai na? So we have to go like this. And this will take time. You have to read very frequently, 1 day, 2 day, 3 day. And that's how the very prescriptions are made. Okay. The other line he wrote that sometimes they are telling us the same motive, but with a different expression.
Yes, sir.
हाथ अपना रहे, किसी और का रहे, पाम ठोकने से आराम लगता है, दिस इज हेलिबोरस।
यस सर।
आया नहीं क्या ध्यान में?
Yes, sir.
We had one very good case of Dr. Fatak that उन्होंने देखा कि एक पेशेंट को मम्स है, and he was lying on this side, right side में मम्स था, right side में वैसा रहता है, ठीक है, he given ब्रायनिया like से प्रेशर से, तो बोले ही वाज नॉट गेटिंग बेटर। तो बोले क्यों नहीं? मैं ना उसको सर ना क्या हो रहा है, मैं बोला सर ऐसे यहाँ पे लेटता हूँ। फिर उन्होंने क्वेश्चन किया कि भाई सर यहाँ लेटे हो दर्द नहीं होता तुमको? उसको लगता नहीं सर दर्द, मैं ऐसे लेटता हूँ ना कि ये पार्ट को कुछ टच ना और वो हैंग होता रहे,
Yes.
better by hanging. Conium, he prescribed conium. Next day patient was better. The whole thing is to have मतलब वो आपको ना उसके जो वेरिएशंस बोलते हैं उसको अपन,
Yes, sir.
एक रहता है ना बॉल एक ही रहता है, ठीक है,
Hmm.
ग्रिप उसका एक ही रहता है, पर अगर ऐसे करो तो उधर स्विंग होगा, ऐसे करो तो इधर स्विंग होगा। सो वी हैव टू पिक द वेरिएशंस कि भाई
Thank you, sir.
वही सेम है ना।
Hmm.
सो दिस विल कम विद टाइम, दिस विल,
Sir,
आप उसके लिए आपको ना धीरे धीरे बाकी बुक्स भी पढ़नी है।
हाँ जी।
जैसे अगर आप नैश पढ़ोगे तो नैश बोलता है वी नो द लैकेसिस हैड ग्रेट सिम्टम ऑफ मॉर्निंग एग्रेवेशन, बराबर है, सॉरी आफ्टर स्लीप एग्रेवेशन,
Yes, sir.
ठीक है। एंड बोलता है कि इफ यू वांट टू प्रिस्क्राइब लैकेसिस इन एलर्जिक राइनाइटिस,
Hmm.
पेशेंट विल टेल यू सर सुबह उठता हूँ छींकें आती है, बीच में उठा छींकें आती है, दोपहर में सोया उठ गया छींकें आती है।
Yes, sir.
Lactasis 200 one dose will settle the business for the season. Same line written in अपना ये Nash. So the symptom is same, the variations are different, the expressions are different.
Yes, sir.
Okay. Yeah. So just pick for it came with the reading and applying. Okay.
Okay, sir. Sir, I just want to thank you for क्योंकि मैंने आपके वीडियोस काफी देखे हैं और काफी सीखा हूँ मैं, और
Thank you.
इसके लिए तो मैं आपको बहुत बहुत थैंक यू सर। यानी
Thank
मैंने
you.
होम्योपैथी रीडर्स पे आपकी एलन की नोट्स और बोगर, इट्स वंडरफुल सर।
Thank you so much. Thank you so much. Any more questions?
Sir, there is one Dr. Vibhuti. She has asked that can you suggest some good remedy for psoriasis of skull?
Oleander. I have to take one name, it is not allowed in homeopathy to take one name. But
Yeah.
yes, Oleander had very good results. And then another one is calcareum wood. Uh, two remedies which if kuch nahi mil raha, then think of two remedies. Oleander is very very good for scalp psoriasis. Any more?
No, sir. Hello, participants. If you have any questions, you can just put it in the chat box. Otherwise, we can wind up the session.
Sir, especially in nowadays we are seeing these asymptomatic cases of lifestyle disorders, no? So diabetes, or they just come with the reports and they are in perfect stable health and no as subject to symptoms and all, no sir. Only in the reports we find the TSH is more, say their menstrual cycles, everything is fine. Only the reports wise they are showing the variations in the sugar level or BP readings. So in such scenario on Allen's or boric method, can you take one session on how to
Yeah,
proceed?
yeah. Look, basically is these are also one-sided disease because what I said na, that it has started from some point, and now that point is not relevant to the patient. Okay, but the disease continues from that point. Okay. For example, I had a patient who had started this his uh, diabetes mellitus after he had loss in his business. Okay, nothing. The patient has not any other symptom. The patient had forgot that he had lost because he had recovered. Now he's settled. Now sab acha hai. All things are good, but the diabetes continued. I have these symptoms. I have only this symptom. So on that element from loss in business, we have calibrom. Okay, and we have prescribed on that. So that's why then go in the anamnesis. How it started. It seemed It is called the accessory symptoms of the chronic disease. You know it, na? Accessory symptom of chronic disease. That patient had the patient is suffering from the symptoms is in so much since so much here. It feels that it is normal. It is normal for sulfur patient to go 2 to 3 times stool in the morning, or you have to do you have to go you have to rush for the toilet as soon as you wake up. It is very normal. पेशेंट से अरे सर पेट तो ना ऐसे साफ होता है, सवेरे उठ के बराबर जाना पड़ता है मेरे को, जैसे मैं आंख खोलता हूँ. दिस इज नॉट नॉर्मल. दिस इज मॉर्निंग डायरिया. As soon as you wake up, you have to go to the loo. But patients think it is general symptoms. Got it? So we have to
Okay,
poke on
sir.
that.
Yeah. Yes, sir.
Yeah.
Yes, sir.
Many patients will tell you na, that I have to whatever. This is the morning diarrhea of sulfur. उठे बड़ा जाना पड़ता है. मेरे को वो खाली चाहिए सर, तो मेरा फिर गड़बड़ हो जाता है. Okay. And we also not take a note that this is also we can take this is morning diarrhea. This is a soric this is a soric symptom. Okay. Yes.
Yes, sir.
So we have to
Okay.
look on that. Maybe we'll take session in future, but this is how we can proceed. Go in anamnesis, how it started. थोड़ा deep करो. Okay.
सर आई हैव क्वेश्चन कि सर हमको पता है डेली पढ़ना है, लेकिन सर
हाँ,
हाउ टू रीड डेली? सर
How to
दैट इज
read
द
daily?
क्वेश्चन.
Daily पढ़ो, simple. बुक उठाओ, पढ़ो, पेन लो, रंगाओ, खत्म.
ओके सर.
Nothing. Will have Dr. Dubey. You know Dr. Dubey, who had
यस सर.
he had everything by heart of Alan Keynote, every line of Borik he had by heart. How he had reached to that level? My teacher, Dr. Sarkar sir, used to tell us that Dr. Dubey sir who was to go for Ganga Snan every day from his home to the Ganga Ghat. The distance was 20 minutes by tram, to and fro. 20 मिनट जाने का, 20 मिनट आने का. Okay. So in that 20 minutes, he used to carry his Allen Keynotes and he has to read daily. 40 minutes daily for 12 consecutive years.
यस सर.
That will happen. That we had the greatest master of Allen Keynote, Dr. Dubey. And it will not come in one day.
यस.
We have to keep practicing, keep reading, keep practicing, keep reading. Okay.
बट
Yes,
सर
sir.
पेशेंट्स एक्सपीरियंस इज वो आपको बहुत जल्दी लर्न करवाते हैं, मैंने ऐसे देखा है.
100%. मेरे को जितने सिम्टम ज्यादा याद है वो पेशेंट से ठीक करवाए हुए हैं.
यस.
100%. And sometimes I have not देखा था कोई सिम्टम जो मेरे को पता भी नहीं था यहाँ पे है करके. I पेशेंट ने बोला, ढूंढा, मिला, then I now this symptom is like in every hand के ये हर बार पूछ नहीं है करके.
यस सर.
You know, that's practice.
So there is one last question by Dr. Kiran. Menopausal symptoms with GI symptoms, basically irritation, flatulence, constipation. Which remedy we should see for?
You can think of sanguinary canadensis, hot flushes with gastric symptom. That is acidity. Naxomica doesn't have these hot flushes. The hot flushes is a symptom of sanguinary can. If you see a hot palm and sole hot flushes, and with this acidity, sanguinary can mostly helps. If you maybe other symptoms will help in the justification, but sanguinary can is also one of the best remedies for these heat flushes because it combines
Hello,
both the
sir. What,
aspect. Heat. Yeah.
sir? What about the lactasis side? Given the lactasis patient, the same, the gastric complaint,
Lactasis.
menopausal, and this
Yeah,
I
but lactasis.
repetize, and then I.
Yeah. See, sometimes the two pathologies are also characteristics for me. The presence of two different pathologies or two different set of symptoms are also characteristics. So we have to look in that way. Don't don't segregate it. It become more confusing. So we have heat flushes, we have acidity, combine it, salmonella can maybe the remedy. Maybe the remedy. Lachesis, we have to have the whole percent of lachesis. Other symptoms also. Otherwise, lachesis will cover A to Z of the complaint.
Okay.
So the patient should be lachesis. That's why I'm telling. If you are going through because lachesis, calcarea, sulfur, diarrhea, these are the medicines which come on the first in the first few lines in the columns when you reproduce the case. These are the common symptoms. Okay, so that's why
Yes,
I
ma'am.
think beyond that. Okay.
Okay, sir. Thank you.
Sir, in PCOD cases, the anovulatory cycle, what should we prescribe?
Anovulatory cycle. I
यानी
mostly
इसमें
prescribe
ओवुलेशन नहीं हो रहा, यानी ओवुलेशन मैंने ओवुलेशन स्टडी करवाया, ओवुलेशन नहीं हुआ, मैंने पसेटला दी, पीरियड्स नॉर्मल हुए, लेकिन ओवुलेशन नहीं हो रहा.
समटाइम्स ना उसके लिए भी अपन दो देखते हैं. दिस इज एट्रोपी ऑफ ओवरीज. ओके, ओवरीज काम करना बंद कर रही है बेबी धीरे धीरे, जो तो वो पकड़ के मैं आयोडम भी देता हूँ. हाँ, अदरवाइज फॉलिकुलिनम, ऊफोरिनम आर वेरी गुड ड्रग फॉर दिस अनओवुलेटरी फेज.
ओके सर,
ठीक है. दिस टाइम
फॉलिकुलिनम
एंड ऊफोरिनम. Foliculum had different. If you go through Murphy's Lotus Medica, na, you will get the different indications of ufernum and folliculinum. It help very much in this anovulatory phase.
So in which potency?
200 and above.
Okay.
These are mostly sarcode. That's why we use it on this medium potency में हम ज़्यादा देते हैं. 200 1 m ऐसा एक dose करके देते हैं. Then we will see what happens like that.
Okay.
Okay.
ठीक है. Thank you, sir.
Thank you. Thank you so much.
Thank you so much, sir, for this truly insightful and inspiring session. Your depth of knowledge and clarity was like really good. We deeply appreciate the time and energy and heart you have given to this webinar. I thank you on the behalf of entire Homeopathy Musings team.
Thank you.
And yeah, as per like messages coming, we will look forward. We hope you will come to again on in the future on our platform. And until then, yeah, we can carry this.
Thank you so much.
Thank you so much.
Thank you so much, everyone. Thank you so much, every participant who is kind listening. And thank you so much, Homeopathy Musing, for inviting me, giving this privilege. Thank you so much.
Thank you, participants. Thank you for joining us on the Sunday. It's like Sunday morning learning. It was great.
I apologize because this is the only time I'm getting free. And
that's fine, sir. That's fine.
Yeah, that's why it is. I know it is on Saturday, but Saturday I don't have the slot allotted to me. It is my clinic time. That's why I shifted it to Sunday. So I apologize for that. Thank you so much for sparing your Sunday with me. Thank you so much.
Thank you. Thank you, sir.
Thank you.